I came down with Lyme disease about 21 years ago. I had been out with my then 2-year-old daughter. We were sitting in the grass at the Sausalito Art Festival waiting for a puppet show, and there were ticks everywhere.
I came down with Lyme disease about 1.5 years ago. I got really sick, ended up in the hospital. Basically just couldn't figure out what was wrong with me. Did a bunch of tests, sent me home. I ended up back in the hospital a week or so later. They thought I had meningitis.
Lyme disease is transmitted through a tick bite. It's caused by a bacterium called Borrelia burgdorferi, which causes an infection in multiple organs. Typical symptoms include things like fever, headache, characteristic skin rash that looks like a bullseye, and if left untreated, the infection can spread to the joints, the heart, and even the nervous system. There are some cases where patients have developed chronic neurological complaints, which include shooting pains, numbness, or tingling in the hands and feet, and problems with concentration and short-term memory. There are many species of ticks found in the United States, with 12 being potentially harmful to humans and animals. Ticks are becoming an issue for people and animals as populations continue to expand into more wooded areas. The species of most concern for humans is the black-legged tick or the deer tick. Ticks must attach themselves to a host in order to survive. They use a variety of small animals, including birds, rodents, and domestic animals, like your dog or cat, and white-tailed deer, hence the name deer tick. The presence of the white-tailed deer is a good indicator of whether or not your area has the black-legged tick. Ticks are found in areas with high grass, like in a field, and more commonly in the forest. Hikers are generally more prone to picking up ticks because they are in the tick's ideal habitat, but ticks can also thrive in your backyard if not properly maintained. The best way to prevent Lyme disease is to prevent getting a tick bite. If you're going hiking or know that you will be walking through an area that's wooded or has tall grass, you should probably use a bug spray, preferably one that has a high percentage of DEET. For your backyard, it's important to mow the grass, trim the bushes and trees, and remove brush and leaves from the outer edges of your lawn.
I ended up going to a Lyme specialist who also did a lot more tests, confirmed that I did have Lyme. I hadn't had it for too long, but I had it for at least a few months, and that it was in my brain. From there, I started an intense regimen of high doses of multiple different antibiotics.
Right now, the only effective treatment is antibiotics. However, there are other supplemental treatments and therapies that can make patients feel better. Bullseye rash is usually a sure sign of Lyme disease and is enough evidence to start appropriate treatment. Unfortunately, there's no reliable test to determine if someone has contracted Lyme disease. False positives and false negatives often occur, though false negatives are far more common.
I got really sick, ended up in the hospital. They basically just couldn't figure out what was wrong with me, did a bunch of tests, sent me home.
Make sure you ask your doctor to carefully evaluate all of your symptoms to see whether you have Lyme disease, even if your tests are negative.
I never got any type of circle, I never got the bullseye, no rash, nothing.
The thing that's interesting about the rash, you hear about this bullseye rash and everybody thinks that everybody gets it, but that's not the case. Late-stage Lyme disease is often misdiagnosed as other conditions such as multiple sclerosis, chronic fatigue, and even anxiety. Often people are misdiagnosed and get treated for other illnesses, and these treatments that they receive are not appropriate for Lyme disease.
Go to a Lyme specialist who you have researched and you think knows their stuff. Don't hesitate to walk away from the doctor if you don't trust them or if they don't seem like they really know what they're doing.
Don't be afraid to get a second or even third opinion. Doctors can easily focus too narrowly on diagnosing a single symptom.